Your first injection feels scary. I know, your hand is a little shaky, you're staring at that pen, and your brain is telling you every worst-case story in the book. Take a breath with me. By the end of this video, you're going to feel like a pro, because I'm going to walk you through every single step, slowly, the same way I've done for thousands of patients. Hi, I'm your GLP-1 nurse. I've given and taught more injections than I can count. And here's the honest truth I tell every patient. This gets easy faster than you'd ever believe. Most people tell me that by their third or fourth dose, they barely think about it. The needle on these pens is tiny, much smaller and thinner than the ones you picture in your head. And you are far more in control than you feel right now. So here's the plan. We'll cover how to store your pen, how to pick your spot, how to prep, the exact injection technique step by step, my favorite tricks to make it hurt less, the mistakes I see most often, and a simple way to rotate your sites so your skin stays healthy. Ready? Let's take it one calm step at a time. Let's start before the injection even happens, with storage, because it affects comfort more than people realize. Your unopened pens live in the fridge, on a middle shelf, not the door, and never the freezer. If your pen ever freezes, don't use it. Set it aside and call your pharmacy. Here's the comfort tip. Cold medication stings more going in, so take your pen out of the fridge about 15 to 30 minutes before your injection and let it come closer to room temperature on the counter. Don't microwave it, don't run it under hot water, don't leave it in a sunny window. Just let it sit and warm up gently on its own. Once your pen is in use, some GLP-1 medications can stay at room temperature for a set number of days, but that window is different for every product, so check the leaflet that came with yours and follow that exactly. Now where does it go? GLP-1 injections go into the fatty layer just under your skin. We call that subcutaneous, and you have 3 good options. Let's walk through them. First, the abdomen. This is the most popular spot, and my usual recommendation for beginners. Pick anywhere on your belly, but stay at least 2 inches, about 2 finger widths away from your belly button. It's easy to see, easy to reach, and there's usually plenty of that soft fatty tissue we're aiming for. Second, the front or outer thigh. Great choice if you'd rather not use your stomach. Use the meaty part on the top or outer side, roughly midway between your hip and your knee. Easy to see, easy to relax into. Third, the back of the upper arm. It works well, but here's the catch. It's hard to pinch and inject on your own arm. Most people need a partner or caregiver to help with this one. If you're doing this solo, the belly or thigh will be your friends. Whichever you choose, aim for soft, fatty tissue, not directly over a muscle, a bone, a vein, a bruise, a scar, or any area that's red or tender. Okay, let's prep. Doing these little steps in order is what makes the whole thing feel smooth and controlled, so take your time. Step 1. Wash your hands with soap and warm water for a good 20 seconds, and dry them. Clean hands every time. Step 2. Check your pen. Look at the medication through the window. For most GLP-1 pens, it should look clear and colorless. Confirm it's not past its expiration date, and confirm the dose showing is the one your prescriber told you to take. If your pen uses a screw-on needle, attach a fresh one now, exactly as your leaflet shows. Step 3. If your medication requires priming, sometimes called checking the flow, do that before your very first use of a new pen, following your specific instructions. This clears any air and confirms the pen is working. Not every pen needs this, so again, your leaflet is the boss. Step 4. Clean your chosen spot with an alcohol swab, in one smooth motion. And then, this part matters, let it air dry completely. Injecting through wet alcohol is one of the biggest reasons an injection stings. Give it those few seconds to dry. Don't fan it, don't blow on it, just wait. Here's the part you've been nervous about, and I promise we're gonna make it feel simple. I'll count you through it. Deep breath in, and slow breath out. Let your shoulders drop. Here we go. Pinch. Gently pinch up a soft fold of skin at your clean site. This lifts that fatty layer up and away from the muscle underneath, which is exactly where we want the medication to land. Angle. For most GLP-1 pens, you'll press straight in at a 90-degree angle. That's the pen standing straight up against your pinched skin. A few situations call for a 45-degree angle instead. So if your instructions say so, follow them. When in doubt, 90 degrees into a pinch is your standard. Insert. Place the needle end flat against your skin and press the pen in with one smooth, confident motion. Confident is kinder than hesitant. A quick, calm press is far more comfortable than a slow, timid one. You'll feel a tiny pinch, and honestly, most people are surprised by how little they feel. Press and hold. Press the injection button all the way down. You may hear or feel a click. Now, this is the step people rush. So don't. Keep the pen pressed firmly against your skin and slowly count to 10. Many pens need you to hold for around 6 to 10 seconds to deliver the full dose. So give it the whole count. 1, 2, 3. You're doing great. All the way to 10. Release. Lift the pen straight out, at the same angle you went in. Let go of your pinch. If you see a tiny drop of blood, just press gently with a clean cotton ball or gauze. Do not rub the area. And that's it. That's the whole thing. You just did it. Then safely cap and drop the used pen or needle straight into your Sherps container. Never the regular trash. Let's make every future injection even more comfortable. Here are the tricks I share with all my patients. 1. Room temperature medication. We talked about this. Warmer medication stings less than cold. This one change makes the biggest difference for most people. 2. Numb the spot. Hold an ice cube wrapped in a paper towel against your clean site for about 30 seconds. Then, dry the skin before you inject. A little numbing goes a long way. 3. Let the alcohol dry. Say it with me. Dry skin, no sting. Always give that swab a few seconds. 4. Relax the muscle. Tense skin resists the needle. Relaxed skin welcomes it. Sit down, get comfortable, and loosen up the area before you go in. 5. Breathe. Try this. Breathe in slowly through your nose and inject on the slow breath out. Your body is calmest on the exhale, and your mind has something to do besides worry. And a bonus, build a little routine. Same chair, same time of day, maybe a favorite song. When your brain knows the pattern, the fear quiets right down. Now let's quickly cover the mistakes I see most, because knowing them means you'll sail right past them. Mistake 1. Injecting cold medication straight from the fridge. You know the fix now. Let it warm up. Mistake 2. The wrong angle, or injecting at a slant when your pen wants 90 degrees. A tilted pen can leave medication in the wrong layer. Straight in, into your pinch. Mistake 3, and this is the big one. Not holding long enough. If you pull the pen out the second you press the button, you may not get your full dose. Always finish your slow count to 10 before you lift out. Mistake 4. Using the same exact spot over and over. Repeating one site can cause hard lumps under the skin over time. We call that lipohypertrophy. And those lumps actually make the medication absorb unevenly. The fix is simple, and it's our very next tip. Rotate. And a quick one, don't rub the site after. Press gently if you need to, but no rubbing. Here's the easiest way I know to keep your skin healthy. The clock method. Picture your injection area, say your abdomen, like the face of a clock. Your first injection goes at 12 o'clock. Next time, you move to 1 o'clock. The time after that, 2 o'clock. And you keep working your way around the circle, giving each spot time to rest and recover before you come back to it. The rule of thumb, keep each new injection at least 1 inch, about a finger width away, from your last one. You can rotate around one area, or rotate between areas. Belly this week, thigh next, whatever's easiest to remember. The goal is simply this. Never 2 injections in a row in the exact same spot. And to make this effortless, I've put together a printable rotation chart you can hang on your fridge and just check off each week. No guessing, no lumps, no forgetting where you went last time. Speaking of that chart, I made it for you. It's my injection site rotation chart. Print it, stick it on the fridge, and check off each site as you go, so you always know exactly where your next dose belongs. It takes all the guesswork out of rotating. I'll drop the link in the description below. And if this walkthrough helped calm your nerves even a little, do me one small favor. Subscribe and tap the bell. I post gentle, judgment-free guidance for your whole GLP-1 journey, and I'd love to keep showing up for you. Before you go, I want you to hear this. That fear you walked in with, it's completely normal, and it's already smaller than it was 10 minutes ago. Your first injection is the hardest one you'll ever do, and every single one after this gets easier. You're not just taking a medication, you're taking care of yourself, and that takes real courage. So take one more slow breath with me. You've got the steps, you've got the tricks. I'll see you in the next one. Be gentle with yourself.